think I've got them all. Ladies and gentlemen, we're back live with the Louis B. Free Radio Show, Brain Food from the Heartland. A very favorite guest of mine joins us, Cynthia Fisher. Cynthia, so good seeing you. So good having you back on.
Great to be back on, Louis. Thank you.
Thank you. Your work is so important and so incredible. First, tell us a little bit about yourself and your background, if you would.
Well, I'm Cynthia Fisher, and I'm the founder and chairman of patientrightsadvocate.org. And we are focused on allowing all patients to benefit from knowing where they can get the lowest priced healthcare, but the best quality of healthcare at the lowest possible price through healthcare price transparency. And what we know is when we can see prices, then patients and employers and unions that help buy and purchase employer plans, health plans, all of us will get to be able to be in control of our own health with decisions, but also our own financial decisions as well. It's our money. Our healthcare costs come out of our wages and they come out of our paychecks and our savings. And price transparency, who wouldn't want to in Ohio or anywhere else for that matter, want to pay $300 for an MRI versus being overcharged $3,000 for the same quality of MRI in a major hospital? All of us can save.
Yeah, it's outrageous.
It's
what
outrageous.
I've learned from you over the years, and it's just outrageous. Many people don't know about shopping for, and you've given many, many examples of it. If you don't mind, just a couple more minutes about your background, how you got to where you are today. And
yes, sure. Well, I have a science background from my undergrad and a business from graduate school. And I started a company years ago in Ohio. I started in Cincinnati called Viacord and pioneered over 30 years ago, Louis, cord blood stem cell banking. That is stem cells that were left in the placenta and the umbilical cord, which would otherwise be medical waste, are actually life-saving blood cells that are the very early stem cells that, as an alternative to bone marrow, can be used and have been used to save lives. Another sibling in the family or that child, him or herself, who might have cancers like leukemia or certain genetic disorders where this therapy is curative. And 30 years ago, in Cincinnati, Ohio, I founded my business, and it still exists today. And it's now owned by PerkinElmer. But we were price transparent from the very beginning. We charged one price, one patient, all patients. And though we were a lower cost than big nonprofit comprehensive cancer centers that would compete with us, we were the gold standard. We did the best quality of testing. We did the most genetic testing, and we were the go-to for, and still are, the company still is, as the go-to for bone marrow transplant programs. And why we started in Cincinnati was the first umbilical cord blood transplant in our country took place at Children's Hospital in Cincinnati. And so they really helped pioneer the field, and that's why we located there and partnered with the University of Cincinnati. Yeah, all started in Ohio.
Wow. Cynthia Fisher, I've got to ask you this. What do you think it was? I mean, what was with respect to Malcolm Gladwell, who wrote the book Tipping Point, what was the tipping point for you that said, what if we did this?
For patientrightsadvocate.org?
For your business. No, for the
Viacord business. Oh, well, I had been running a blood stem cell medical equipment division for a company that worked with bone marrow transplanters throughout the world. And when the first umbilical cord blood stem cell transplants took place, well, I knew that logistics and service needed to be set up because babies are born into the beginning of life, right? And those that were dying of cancer or certain genetic disorders were facing death's door, and they weren't necessarily the same disciplines in a hospital system. So and or the location of collection would be wherever a baby's born. So I knew the world of stem cells, and then set up a gold standard and had a wonderful team of scientists help. And in fact, it was Dr. Hal Broxmeyer over in Indiana at Indiana University that had done the really early research, and he joined our team scientifically to be able to provide the best quality of really cord blood stem cell collection at the time. So I left to go pioneer that field 30 years ago. Yeah, it was a crazy endeavor, but I was young. I was really 30 years ago.
Cynthia. And then again, obviously very successful with that. So what was again, I'll go back to the tipping point for when you decided to do patientrightsadvocate.org? What was it? Was there something that said,
well, through all the hard work at being able to go into this field as an entrepreneur, I also, I sold my company, and I now am in a position of, philanthropic work, right? And what the tipping point was, Louis, was really a perfect storm of people near and dear to me, a former employee that I just checked up on her. I knew she had breast cancer, and she was from Brown County, Ohio, Georgetown, Ohio. And she had taken care of my in-laws until they had passed. And she ended up being medically devastated from the financial ruin that having breast cancer had for her. She actually lost her home, and I helped her file personal bankruptcy and get back on her feet. But she also had been treated with the wrong protocol. So I was flying her to Boston, helped her out of bankruptcy to be able to get on an appropriate cancer protocol, but it was too late because the damage was done to her organs, and Judy's no longer with us. But she helped us on this cause. But it was her, and at the same time, a handyman who worked with me, because he turned the lucky age of 50, his wife scheduled for colonoscopies, and the anesthesiology bill was $6,000, and they didn't accept his insurance. And he had no idea. And he ended up not being able to afford to keep his son in Catholic school, and big alligator tears. And he looked to borrow money. And then at the same time, a nurse at Mass General in Boston was told that she needed a certain protocol for her cancer that was proton beam, but she didn't have the money because they, in their own health plan for her, they didn't cover it. So they set her up with a social worker to become a beggar. They set her up to raise $38 million in a GoFundMe account. And these three people coming to me within 2 weeks to help loan them money or give them money. I basically said, oh my gosh, these people have jobs. They have insurance, and they're being devastated with medical debt, one even losing her home. And I thought, this is criminal. The healthcare system has run amok. The greed has run amok. There is something desperately wrong that hospitals and insurance companies and pharmacy benefit managers are all capitalizing on the misfortune of people's health. And so the problem was that I saw that no one knew what things are supposed to cost. And so what is the price? And so I decided to put my philanthropic dollars into patientrightsadvocate.org, go to Washington, and hire a bunch of great lawyers that weren't affiliated with the cartel. I call the cartel the health industrial complex, because I had to find a team of people that would find in existing law where we absolutely have the right as consumers to know prices and have a market economy in healthcare, because we've been blind to know prices, Louis. I mean, how many of us, you yourself told me stories in the past where you were blindsided by an outrageous overcharged medical bill. And then on top of it, whenever we get care, we have to sign that we will pay with a blank check. So I just thought this was wrong on every level, and that the only way we can get to fair market and fair market prices and empower patients is to know the price. It was really simple. It's the price. I think there was an economist that wrote, it's the prices, stupid. We need to know the prices. And so we found an existing law, 3 existing laws. We found that we have the right already to knowing prices and actually knowing what we paid in the past, even. Like you get a restaurant bill and a restaurant menu to know the prices. And the problem was it was never put into rule of law. It was just sitting on the shelf, never made into actionable law. So that's what we did. We went down during the Obama administration. We found it, started working with them, and then moved over when Trump came in, and the Trump administration ran with it. And with 6 months of taking in, here's how these laws give us this right. They're like, my goodness, we'll get this done. And they did. They got it done. Big deal. It was a big deal. And then
Huge.
Biden weighed in and made the penalties higher when the hospitals
Right.
weren't complying with actually posting all of their prices, which is why I'm here on the show today.
Cynthia Fisher, when you say that, and again, back to, I was self-pay back then. And again, was that smart? Well, of course it wasn't smart, but again, it was what it was. And it was fine for a while. We were much younger, fine for a while. But when you have an emergency or something, or just have to have a test or something, it's and then not know about the pricing, to not know obviously you can't shop around when you have an emergency, obviously. Yet when you've got to schedule a test or something, you can. And you've brought that to the forefront of that for people to know. Obviously, I'm well into my senior years, and there's Medicare, and it's interesting because I've just got to say, people will say they've got something called silver sneakers, and there's another one where you can go to a gym, like the YMCA or something, or the Jewish Community Center or whatever, and people always say, well, it's free. Well, it's at no additional cost, is what I say. It's no additional, it's not free per se. But again, shopping and knowing that even when you've got coverage, you've got to know. And it's only fair to shop, correct?
That's right. Over 90% of our healthcare is scheduled. We know in advance it's elective, or we're going to go in for a blood test or a physical, or even childbirth is an advanced. You have 9 months but people don't even know what the prices are to have a baby. And in one hospital, it can be all in $7,000 to have a regular vaginal birth. And in another hospital, it'll be $45,000. Or maybe even in the same hospital, you'll see that level of price variation based upon what health insurance coverage you have. And that's a big deal, because people don't know that in the same hospital on the same day, one woman can pay a little over $6,000 for a C-section, and another woman will be charged over $60,000 for her C-section with the same medical team on the same day in the same hospital. So, they don't know that their health plan rates that were negotiated by that Blue Cross or that United or that Aetna plan really aren't competitive compared to what would be a fair market price. And so when all of us can see all of these prices, none of us would tolerate being charged 10 times more when we can compare these prices. And both us as workers or employers who help purchase plans that we get as workers, there's no reason why we can't negotiate for a fair market price. We just have to see them and know them. And that's what's happening across the country, is people are just starting to know they can shop. That's a big deal. Hospitals have to show their prices. And as of July, Louis, every health insurance plan now has to post on their website, and employers have to post on their website the rates that are negotiated for all care and coverage with every provider, not just within a hospital.
Yet your new report shows that only 16% of hospitals are complying with the hospital price transparency rule. That's disappointing. Doesn't even cover it. That's awful.
Yes, it's actually, it's an insult to the American people that actually the hospitals have stalled. We've done 3 reports now, Louis, and thank you for having me on the air with each one. Our first one was
talking with you.
5.6% of the hospitals. The second one was 14.6% of the hospitals. Okay. Now we're at 16%. We would have thought that at
Would
least
be,
half the hospitals would
yeah,
have been on board.
yeah.
But we're now 20 months into this law. Okay. And it has $2 million fines per hospital. And what our report also showed that finally, Secretary Becerra at Health and Human Services finally fined 2 hospitals, only 2. But of the 2 that were fined, Louis, guess what? Within a couple of weeks, they posted online exemplary files. So their files are actually very, very good. And we cite them as being a good example for other hospitals to follow suit. But they were fined over $1 million. Because they weren't compliant. But the issue is that we need compliance with all the major hospital systems.
Yeah.
I mean, sadly, you know, where the first cord blood transplant was done in this country at Children's Hospital in Cincinnati, they're not compliant. And boy, people with young children, they need to know where a blood test can be affordable or if their plan is competitive. And if they can save on an MRI at a standalone center and get one for $300 versus pay $4,500, because some of those hospitals, not only do they charge thousands of dollars for an MRI, they add a slap on an $800 facilities fee for just entering a teaching hospital. I mean, it's ridiculous.
You know, again, I don't want to try to justify it, but if it was not those numbers, but if it was $500 at a standalone, and it was, say, for example, and it was, I don't know, $600 at the hospital or whatever, you know, and maybe, I don't know, maybe there would be a justification because the hospital, you know, or they would see it. But these numbers are outrageous. This isn't like a little more. This isn't like 10 or 20% more. I'm not saying that would be okay. These are thousands and thousands of dollars more, which is outrageous.
That's right. And in fact, in Ashtabula, the superintendent of schools started using the price transparency numbers, and he lowered the cost by millions and millions of dollars for those teachers and those teacher plans. And he gave me an example. He's like, look, you know, he was able to go to a price transparent facility for his employee, was able to get a knee replacement for $19,000 by going directly to a price transparent ambulatory surgical center. And he had others in their plans in the past that had gone to an opaque major hospital. I'm not going to name it. Okay. And they paid over $75,000 for knee replacement. He said, you know, he could pay for a teacher's salary with the savings that they were able to make just on one knee replacement. So incredible. This is why transparency in pricing and is really important. And people say, well, wait a minute, I want to know what I'm going to get. Like, what's the quality? And of course, we want to know quality. And that also can be transparent. And we have to start with the price, because what's so important about price transparency is it will usher in transparency in quality and outcomes, because people will want to say, well, compete. I want to know what I'm going to get and at what price. And the amazing thing is that the most expensive surgeries happen to be among the lower quality. There are scientific peer-reviewed studies that show that if your costs are actually higher, you know, you're in surgery longer, your surgeon might not be as, you know, skilled or as efficient, and you're being charged for every minute of anesthesia. You're being charged for every medical supply that's being used. And the more money they make is not necessarily correlated to providing the best outcome. And so this is actually eye-opening, because but I know it can be done, because that's what we did with my Viacord business, was we were providing the best quality at among the lowest prices and making it affordable for so many more people. And that's what we can do in this country. We have to have these prices lowered, because, Louis, when we compare the US to any other developed country, we are paying now over 2.5 times more than the rest of the world developed countries for healthcare. Well, that doesn't only just affect us as American workers, because we pay for all healthcare. We
That's
pay
right.
for our own, right?
Yeah.
And then we pay for other people's through our taxes. And 48% of our taxes end up going into healthcare for the state and federal use of Medicare and Medicaid and state plans. So if we look at this as what it means to our country and our economy, the best thing we can do is shop and demand the best price and the best care.
And again, when you, like you say, we're all paying for it somehow.
Mhm.
Some people, you feel that, you've got your employer provides or whatever.
Right.
It's all, yeah. And when they can find the best prices in the best way, then it's good for all of us, Cynthia, for sure. When you say that about some of the price differences in that, and then learning, let me get back to when you said about the hospital that was fined $1 million. Again, nobody wants me to talk about economics, except if a hospital is making, I hate to say, what's the expression, cost of doing business. Maybe I hate to say manageable for them, but okay, so they didn't have to do this, and $1 million. Okay, we're making, I don't know how many, hundreds of millions, tens of millions of dollars.
Louis, when hospitals and insurance companies can hide their prices, they can charge whatever they want. There's no accountability. And in fact, they've been trying to game this whole price transparency, where each of them have to post the actual prices that they've negotiated, because they do negotiate on actual prices, dollars and cents. And they're hiding it. They're putting it in as formulas or percentages of Medicare, or they're putting NAs in their field, but they're also hiding it through saying, oh, we'll give you an estimate. But before you get an estimate, we want to collect big data on you, the patient. Give us all of your information. And then they put them down a rabbit hole and give them an estimate, but you can't get the estimate unless you check a box that says you won't hold the hospital accountable for that quote. Now, how does that work?
That doesn't even doesn't make sense. It's like, I'm getting a quote, I'm getting an estimate, but it really doesn't matter, because you're checking a box that says, oh, okay.
Yeah. So it's gaming, and the greed is run amok. And in most cities and towns, the hospitals are the crystal cathedrals. It used to be the churches, right? But they are the crystal cathedrals. And, some of the CEOs, this is about big business. This isn't about the doctors and nurses, Louis, because
sure,
the doctors and the nurses are delivering the care on really stressed schedules and doing the best they can. This is about, most of those doctors have been bought up by the hospital systems, and their nurses' wages have not gone up. Why have they not gone up? Because we've seen the health coverage go up double digit. Okay, double digits year over year. And I'm not kidding you. I was giving a talk, and I gave an example of one insurance plan for a small employer that had 34 employees that went up 18% in 1 year. Well, guess what? Someone in the audience stood up and said, my husband's plan went up 81% in 1 year. For a minute, I thought it was a dyslexic number.
Yeah. It was just
81%. And we just were in New Jersey with the police. The police union was protesting, along with the CW workers, and their insurance coverage with Blue Cross went up 24% in 1 year. That meant their portion coming out of their wages was going up and depleting at a time when inflation's gone up around 9%, right, Louis?
Yeah.
Inflation's at 9. So how do the hospitals and the insurance companies justify a 24% increase? That's crazy money. That's crazy money.
They don't have to justify it? Is that?
Yeah, absolutely, because there's been no accountability because we haven't had system-wide transparency, and we haven't had a system-wide market forces of being able to compare prices. It's outrage. And then, the insurers get paid on the top line, and they get to keep 20% of the revenue on the total amount that gets gone to an employer plan. Well, my goodness, when you look at that, their incentive is only to see it increase so they can make more money every year. It's not to do the savings and be smart shoppers. So that's why it's now our moment. This is truly transformative. Healthcare price transparency is so transformative because it shifts the power from the cartel, the healthcare industrial complex. It shifts the power to the consumer, power to the patient. It shifts the power to employers and unions to be able to run the numbers and steer their employees to get great quality care at a low price and add the money back into wages and higher bonuses for shopping. So we know employers that are doing that already, and most of them are like Ashtabula School District. There's a bunch of unions and chemical plants and employers in Ohio that are just said, no more. We are not going to take it anymore. We are going to actually get control of our contracts with these insurance companies and what they've negotiated with the hospitals. And we're going to drive down the costs for our employees and add more to wages by encouraging them to look for these prices and shop. But right now, we know the hospitals are really gaming the system. They are not compliant. They're not easily making all of their prices known for every consumer. And, this is our right by law. So all of your listeners have the right to demand the prices and to know it before they go. And if they can't see it and find it online, they should write a letter to the CEO of the hospital and CFO and ask them to comply with the law. In Ohio, we looked at 64 hospitals in Ohio, Lily.
I've got the report in front of me. Go ahead.
Only 8%. Only 8% of the hospitals are compliant.
And I want to say again, I'm talking with Cynthia Fisher at patientrightsadvocate.org. I'd urge you, we've got the links up. Just go directly to patientrightsadvocate.org. As you were saying earlier, and I have been to local hospitals. I've somebody close to me has been getting some treatment up at Mercy Health at St. Louis Mercy Health. And again, I am in awe of the dedication of the nurse, everybody, staff, the physicians. So this is not I'm doing like a disclaimer. It's not like you were saying before, Cynthia Fisher. I'm not talking about the physicians. I'm not talking about the nurses. I'm not talking about the staff. Yet when I looked at this report, again, you were talking about Mercy Health, St. Elizabeth Youngstown Hospital, non-compliant.
That's right.
Compliant. And it goes on, St. Joe's in Warren, non-compliant. It goes on. And the one piece that I have, analysis finds Bond Secures Hospital not compliant with the hospital price transparency rule. And it was a New York Times article, and they own C Health here. So again, it's shocking when I looked at that, because again, not criticizing the staff, not criticizing all the wonderful people that through the pandemic continue to go to work, and they're there for you. And I'm glad that we've got hospitals in case for any reason, but an emergency, we take it for granted. Something's wrong, you go to the hospital. Yet not non-compliant freaks me out.
Well, it's really a shame. I mean, even the Cleveland Clinic, their main Cleveland Clinic is compliant. However, they bought up a whole bunch of hospitals. They have a lot of other hospitals out there, like Cleveland Clinic Union Hospital. There's nothing. Cleveland Clinic Lutheran Hospital, non-compliant. Cleveland in Medina, Cleveland Clinic.
Medina, Akron General.
Akron Children's is compliant. Akron Children's is compliant. So we give a hats off for them. And Clinton Memorial Hospital is in Wilmington is compliant. But, Children's Hospital in Cincinnati is not compliant. And this is really harmful to patients, because 100 million people in this country have medical debt they never knew they would have. Way overcharges. And if you are able to get a price, Louis, in advance. If you've been overcharged, you can fight that then, right? You can remedy and get recourse. And we had one young man come to us where he was charged $15,000 for an EpiPen.
I
And
we talked. Yeah, tell that story. I'm
remember
sorry.
that? Yeah, $15,000 for an EpiPen. And he had a $5,000 high deductible plan. He was 20 years old at the time, so last year. And his insurance negotiated it down to $4,900. Fancy that. When he went into an emergency room for a nut allergy, they gave him a little bit of epinephrine and saline, and that was reasonably priced. But then they handed him the EpiPen. That was the magic wand of 15,000 charged from the hospital.
15,000.
And so he was like, this doesn't seem right because I've gotten EpiPens before for less than $70, you know? And so he came to us and he said, how do I fight this? We helped him. So anybody can go to our website, patientrightsadvocate.org, and we show you how to shop and we show you how to fight a medical bill that you think is erroneous or an overcharge. And basically, we actually looked online, and the hospital actually did have the prices listed. And his plan, the top charge master price at the hospital, which is a crazy money like rack price that nobody really pays, was $600 for an EpiPen. And his insurance had negotiated a little over $300. And so when he printed that out along with his crazy bill, he was able to write the CEO of the insurance and CEO of the hospital and CFO and say, you overcharged me, both of you did. And they both agreed to it, said it was, it must have been a glitch in their system. Haha, how many glitches happen to all of us out there that get medical bills? And they basically forgave the whole bill. They forgave the whole bill. And that's a big deal because otherwise,
huge. Sure.
Credit rating went up. He was already sent to medical collections. This kid didn't have $5,000 to his name. He was a college student.
And even if you do, it's still outrageous. Even if you have, I don't want to say an extra, if you can pay it, you could, it's outrageous. And by the way, in the new report, looking at some of the other hospitals and again, in this area, I'm looking at Monroeville, UPMC, Harrisburg, it's Pennsylvania, Newcastle. I'm looking at so many of these, Children's Hospital of Pittsburgh, UPMC, non-compliant. Again, it's outrageous.
Yes, they're flouting the law.
Yeah,
that's a new word that I learned. They're flouting the law. They're basically thumbing their nose at the American people to be able to trust them. And this is the hospital administrators. This is the CEOs. This is the CFO. This is the culture starts at the top to flout the law and break the law. And, at the moment in time when inflation is hitting every single family across this country, how do they think that they can overcharge people by 10 times, 20 times? And then on top of it, say they're going to increase their prices by north of 20% this year, which is what the American Hospital Association has been saying. And the industry leaders for the insurance industry that are, partner to partner with the hospitals. It's outrageous. It's outrageous. Plus, these guys got huge corporate jets. I mean, have you seen the multi-million-dollar salaries of the C-suite in these major hospitals? I mean, look at UPMC Pittsburgh. The CEO's office is the top floor of the U.S. Steel building. It now doesn't say U.S. Steel on it. The biggest industry is the University of Pittsburgh Medical Center, and the CEO is on that top floor. Don't you think he could give up that entire top floor and his double-digit high tens of millions of dollars salary to be able to lower the cost of healthcare by simply showing their prices and by putting the savings into the pockets of the American worker?
Again, patientrightsadvocate.org. Cynthia Fisher is my guest. I've got to mention, when you talked about inflation, and again, gas is on its way back up. I know just in the past 2 days, I think since Sunday, it's up like 40 cents a gallon and rising. I went by a gas station. It was $3.39. Then it was $3.59 when I was on the way back, and I saw it for $3.79 and $3.99 this morning. So again, that's affecting all of us, and the prices are going to affect all of us because, again, transportation, et cetera, with the inflation. Yet we don't, because of you, we get to see what's going on in addition to that.
Well, this is really empowering for people because every cent matters, right? I mean, how many of us know where we can buy that cheaper gas at the gas station, right? Some of us will drive an extra couple of blocks or a half a mile further because I know if I fill my tank there, I'm going to save $1, right?
Yeah.
Think about that. We'll spend that time. My mother stands knee deep in line in Costco to pump gas because she gets to have it go back to her Costco card and save even more, right? So she'll wait 20 minutes in the long lines at Costco to buy gas. But think about it. We don't see these prices, and we could save tens of thousands of dollars if we could see the price differences in the same hospital or across hospitals. That is huge to the American public to be able to drive down the costs of care. And it's time for us to get in the driver's seat, Louis, where we as patients can drive down the cost, but we only can do it if we demand to know the prices in advance of care, and it is our right. And even in an emergent situation, when there's competition, who benefits? The consumer. So if you know what a fair market price is in Ohio and California and across our country, right? It should normalize like gas is normalized, unless it's California, right?
Yeah, that's a whole other.
California is an outlier. I think they're paying $6 for gas out there.
Yeah, I saw that. It was outrageous.
So, but I mean, across the, you trust the gas stations are going to be within a normalized range of fairness, right?
Yeah. Yes.
Can you imagine leaving the gas station, not knowing what you would pay and getting charged hundreds and hundreds or thousands of dollars later, a month or two later in the mail,
And that's a great example. That's a great example of that. People would be outraged, and they should be outraged regarding what's going on at these hospitals. I know we're almost at the top of the hour, Cynthia, and I hope you'll be able to do a part 2 with me about this. I shouldn't ask you on air, but about this report. But when you think about it, again, 16%, it's got to be very disappointing. Yeah, it's 16%, but you had to be, when the report was finished, you had to be really disappointed because it's law, correct?
We are. It's law. They're breaking the law. The hospitals are breaking the law. And yet Ohio taxpayers are paying for their tax exempt bonds, right?
Yeah.
And I mean, really, should they get accredited? And should they get all these big billions and billions? Many of these hospitals are borrowing billions of dollars to build bigger crystal cathedrals, right? And buy another corporate jet for their hospital system. Okay. And this is at the expense of the American worker because it's in our taxes that we give them these advantages. And they don't pay property taxes. So they're robbing the school districts.
That's right. Yeah, that's right.
Coming into their big buildings and all the property they own. And one has to know it's not the nuns providing charitable care anymore, right? Or religious organizations looking to provide hospital, right? This is big business. And so the only way we can drive down these costs is to start by all of us demanding the prices to know before you go. And also, if anybody wants to come on and to our website, patientrightsadvocate.org, we teach you how to shop. It's a bumpy time right now. It's not, we don't have the mobile app tools yet to be able to shop like we do for airlines.
Yet. I heard the word yet.
We need the data. Yeah. We need these prices to be unleashed so the tech developers can give us like Expedia or Priceline or, think about it.
Would be great.
We should Uberize healthcare. Like
Uberize.
Why not say I want an MRI and show up and compete for my needing an MRI, and I'll be happy to go within a 15-minute radius to get an MRI at the best cost, best price. So
Which makes, yeah, go ahead.
these tech platforms exist. We just need the pricing data so that they can provide the tools for us to shop.
The transparency. Michael Russo says, great information, much needed. Thanks for having this guest, Louis. And I appreciate Cynthia Fisher, because again, it is so important and affects all of us. So go to the website, right? Cynthia, like you said, go to the website,
Yes.
patientrightsadvocate.org. There's tools there. You'll learn more. You can read the report. Again, you'll be freaked out. I freaked out, I guess, is what, again, I was, and disappointed. And when I looked at in this area, Pennsylvania, Ohio, across the country, how much non-compliance, again, 16%, and it's law. If I don't want to say if I break the law,
Oh, goodness.
yeah,
Right?
I'm in trouble.
If you
I'm
or
in
I
trouble.
break the law, we're in trouble. And these hospitals are breaking the law, and they're supposed to
not.
be fined $2 million. And you got to ask, why is this administration, even though the president stepped in
Yeah,
and you got bipartisan support, this is a 92% issue among voters that they all want to get prices because they know they can lower the cost when they get to benefit from competition and choice. We do it in every other market because every other market is functional, except for healthcare, because the consumer has been kept in the dark.
and
So this is our era. It is truly transformative, but every one of us is going to need to be our own advocate in healthcare to save our own lives and save our own money. And that's what we have to do. We have to step into those big girl and big boy boots
and
and
do it.
demand prices. And start writing letters. And they have the money, they have the resources to do it. Although you'll hear from the hospitals that,
Yeah,
too expensive, it's too
yeah,
hard.
free.
But
And
I always laugh and say they have no problem billing us every day.
that's right. That's right. And Cynthia, again, when you do this, if they have a law and have a fine and they're not enforcing it,
Yeah.
I get it's a law, but it has no teeth. I think if you're not enforcing it, if you're allowing all these systems to be non-compliant and you're not finding them. So I could, if I want to, again, I'm not playing politics here. If I want to say it's a $10 million fine, and but if I'm not enforcing it, if we're not enforcing it, it doesn't really matter. Make it $100 million, whatever. If you're not enforcing it,
That's right.
It doesn't matter.
That's right. Well, I think that's where if people stay tuned with us, patientrightsadvocate.org, we do, when there are times to advocate to this administration, we do ask for people to write letters and emails, just a quick email to make your voice be heard, to lower your costs and get access to affordable care, and ask them to enforce the law. And then we do know, Louis, that some of the states are taking this into their own hands, and Colorado is making it that any consumer cannot be charged medical debt. They put it into state law. They codified these rules into law, and they said a consumer can actually sue the hospital for double the bill amount if they didn't post their prices for that consumer.
See, that's
they cannot be put into medical debt. And then another state is putting into law that they are going to fine the hospitals and take away their accreditation, that they can't, unless they show their prices, they're not accredited, nor can they get bonds from the public tax exempt bonds.
That's fantastic.
They have
Again,
to be in compliance with the law.
You've got there's a YouTube video up. There's a wealth of information at patientrightsadvocate.org. Cynthia Fisher, I love what you do. I love doing the gig with you. What you're doing is so important for all of us. Thank you.
Thank you. And Louis, every employer and every union throughout Ohio and Indiana, Pennsylvania, they need to take the bull by the horns. It's up to them now to get pricing data from hospitals, the insurance plan, their health claims data, and stop the overcharging, stop the greed, and put the money back into the workers' wages and bonuses. It's all of us, and we all need to become shoppers, and demand better prices and fight overcharges. Again, we can save our money to save.
Patientrightsadvocate.org. Cynthia Fisher, thank you so much. Thank you for doing the gig with me, but thank you for what you do to help all of us.
Thank you so much, Louis.
We'll do it again.
Okay.
Thanks.
Bye now.
She is wonderful. Cynthia Fisher is amazing with and her